Welcome back to this channel. I am Miracle Odechi, and I desire to share content that can help enlighten you and educate you to control and prevent diseases. So today I'll be looking at frequently asked questions on breast cancer. Welcome. Please subscribe, like this video, share to your friends. You can also send a comment down below. I know a lot of questions comes to mind when you hear about breast cancer. I'll be answering a few of them, and if you still have more questions, please reach out through the comments. First, what is breast cancer? Breast cancer occurs when cells in the breast grow out of control, forming a tumor. That's breast cancer. The next on your mind would be, what are the common signs? What are the things that help me identify that, okay, this could be breast cancer? First, you experience lump in the breast, changes in the shape of the breast shape changes, skin dimpling, like people usually have dimple around their cheeks when they smile. So now, but the skin around your breast begin to dimple, that gets deeper instead of being smooth and straight. And then the nipple discharge. You are not breastfeeding, but you are seeing some discharge from your nipple coming out. That's a sign. Another extra sign could be that the skin around the breast area where this lump is looks like the back of orange. The back of orange has some roughness. That's how it looks. So it's no longer the normal way the skin normally used to be, but that area looks like the back of orange. So next we'll be asking, next question is, who is at risk? Who is at risk of breast cancer? First, age. As you get older, many things change about you, so you are more prone to having breast cancer. That's why we cancel that you go for checkup. Next, we have if it's in your family history. I was watching a video clip where the grandmom had breast cancer. She died of it. The mom did, and then the first daughter was already having breast cancer. So it's like a history that comes down. That's why if you have it as a history, I will show you things you need to do as we continue. Genetic mutation. There's a change in your gene. That's why we encourage that you avoid excessive exposure to radioactive, going for scan. A lot of mutations come up as a result of that exposure to that X-ray. Then we have lifestyle choices. The kind of lifestyle you choose can also have influence. Smoking habits and all can hamper your health in the future. Now, this looks very, very like, okay, can men get breast cancer? Now think about it. Do men have breasts? Yes, they do. They have the anatomical feature there, and some of them, it is also padded with skins and some though it's not meant for breastfeeding. The anatomy there is not meant for breastfeeding, but the answer is yes. Though very rare, men can develop breast cancer. They have the anatomy. So if the flesh around there, the skin folds around there, have any dysfunction, they can develop breast cancer. How is breast cancer diagnosed? There are several ways. I'll be showing you. One, we have physical examination. First, you examine your breast. I'll be sharing a video following this one on self breast examination. You don't need to go to the hospital to do this. You can do this right there in the comfort of your home. Examine your breast yourself, and this should be done monthly, so that you are in check and you don't, you are good to go. So you self breast examination, then we do mammograms. That means you need to go to the hospital where they will do further checks on you. Then ultrasound, you can be exposed to, some ultrasound equipment so that they check if there is any lump. What are they looking out for? If you have any abnormal lump growing anywhere around your breast. Then magnetic resonance imaging is there too. It's another means of checking. There may be biopsy. When they check and they see a lump, they begin to check for the tissue around it, if this lump is a cancerous one or if it is just benign. And if it's a benign one, they'll just remove it and you are fine. Then if it's cancerous, there are other treatments they can do around it. It is essential you do this diagnosis. What are the treatment options? We have number 1, surgery. If they discover the lump early, that's why you need to do the self-breast examination. Early enough, they discover the lump, they do a surgery and remove it, and then you're fine. Chemotherapy, when this lump was discovered late. Even surgery comes in when it's discovered late, but then you may be losing a breast, you may be losing some few other things, but if you discovered early, they just remove the lump and you're fine. Chemotherapy, the cancer is already there, so they want to ensure that it is cleared out of your system. So chemotherapy takes place. Then you have radiation. They expose you to radioactive rays so that it can kill any cancerous cells around. Hormone therapy is also put so that you can be put to check. Such abnormal growths would be put to check. So these are treatment options available. Then we have next question: can breast cancer be prevented? I know that's really on your mind. What can I do to prevent these things so that it doesn't come near me? First, healthy eating. Eat well. Many people eat a lot of junks, especially people that find themselves in the city area. I encourage you, at least in a week, get fruits, eat fruits, eat vegetables, drink a lot of water. It will help you. Then limit alcohol intake. Yes, people buy alcohol for fun. Some of them, they are passive ones. When they go for an event and it is in excess, they start drinking. Limit it. Then engage in regular exercise. Regular exercise helps you a whole lot. Engage in regular exercise. Then go for screenings. Some people say, am I up to the age? Is it necessary? The advice we give is, as a girl child, it is because this breast cancer is mostly common in women, although there are rare cases about it in men. As a girl child, once you reach puberty, you need to be scheduling screenings at least once in 2 years, at least proper screening. I know in some the developing countries, those kind of funds are usually not there. That is why I would also explain to you in another video how you can be checking yourself through breast self-examination. Doing that would help you be on alert, and then if you notice any lump, then you report to the hospital. How can I support someone who has breast cancer? How can I support someone who has breast cancer? There are several ways. Maybe you have a friend, a sibling, a parent. Number 1, offer them emotional support. Some of them, when on hearing this, feel like, God, let me die. You need to encourage them. It's not the end of life. People survive it. I understand that some people, when it's discovered late, it can be like very, very hurtful because they don't really know what next. But offer them emotional support, assist them with their daily tasks in one way or the other, help them attend medical appointments. Yes, they need to, at that stage, they will need to, be visiting the hospital for assistance and medical care. You help them attend medical appointments. and encourage open communication. Let them share with you what's on their mind, what they would love to do, and just, keep them company. They need it so much. That's how you can assist someone or support someone who has breast cancer. I believe with the few questions, and if you have more, you can drop them in the comment section. Like this video, share, comment, subscribe to this channel. I really would love to hear comments from you. Any further questions, share, and would work on the answers and respond back to you as soon as. Thank you very much.